tuning in today to the COVID Community Education Talk. We are so happy to have you here. My name is Erica Moore, and I am the District Executive Director of the YMCA at Baptist North and the Johnson Family YMCA.
Hello, everyone, and my name is Diana Rosito, and I'm a wellness coach at Baptist Health, and we will be your moderators for today. Today, we have two very special guests talking to us about all things COVID. As we continue to learn more about COVID-19 and as vaccines become more readily available, we want you to stay informed and make the best decisions for you and your family. So if everyone can please welcome Dr. Tra'Chella Foy, family physician with Baptist Primary Care, and Dr. Shavondra Huggins, clinical assistant professor at the University of Florida College of Nursing.
So let's get right into it. First question is for Dr. Foy. Could you please give us an overview of what a vaccine is and why should we get vaccinated?
Yes, so first off, thank you guys for having me. We can hear each other well? Mm-hmm. Yes, awesome. So I love the events that you guys are putting on, and I'm glad to be a part of it. And this, of course, is such an important topic because we're dealing with this pandemic, but we found a way and an opportunity to really help combat what we are being faced with. And so throughout history, we have had opportunities to try to rid or ameliorate or get rid of diseases that we've been faced with, because there's always something coming along. And it wasn't until recently that in our lifespan that we were able to come up with what's called a vaccine. So before a vaccine, there was actually something called inoculation. And a part of people's hesitancy about getting vaccines is there's some of the myths about who developed it, who's trying to give it to you, not knowing and understanding that really inoculation, or the idea of creating antibodies in the body to protect you from diseases, actually came from thousands of years ago, where Buddhists and Africans did this called inoculation. And it was first introduced to the United States through slaves who were in Boston, and there was a smallpox outbreak. And in that time, the people who were actually infected and sick, many of the slaves weren't getting sick. So one of the slaves was able to talk to his master about the fact. He asked him, why aren't you really getting sick? Why are you worried? Have you had smallpox before? And they told him that in their country, they had a process where they would take a little bit of a sore from someone who was sick and rub it on the skin of someone who was well. And that would cause the person to get a little bit sick. And by that, that would make the body start making antibodies to fight the infection. And that was a natural inoculation. Well, from that, doctors started studying, well, if you expose people to an infection a little bit, we can create an immune response in a person in the same way as if they actually got the infection, but without making them deathly ill, because even back then, many of those infections were killing people. So this started the process from inoculation and what is natural creation of immunity to vaccine, because there became a need, or there was always a need, to create a way to actually expose people potentially, or have people interact with the infection and build this immune system, this ability to fight it, but without making them really sick, without making them have to actually go through the infection. And so that's when they discovered ways to either first weaken the virus, so weaken the infection. And when you weakened it, you would able to give it to the population, and they were able to make these cells that fight it, or these antibodies that fight infection. That was one way we came up with vaccinations. Then it spread to, well, is there a way, because people still, of course, were hesitant about putting something in their body that they felt like was an infection. So then as science progressed and as time progressed, we figured out ways to do it where you didn't actually have to expose people to a live virus or even a weakened virus, where we just were able to use the proteins of the virus or infections and again create an immune response where we fool the body into thinking that it actually is seeing the infection, and our natural immune system, which is meant to fight off things, get activated. And in getting activated, it now is able to fight the infection if it sees it and while it's there. So it's a preventative where your body thinks you've already seen it, so it knows how to fight it. So when you actually get exposed to any infection, the vaccination that you have had allows your body to fight it. And that's why vaccines are so important. And if enough people get vaccinated against certain infections, then we can get rid of them. We can actually rid the earth of them or rid our communities of them. And we've made progress in a lot of diseases that we may talk about a little bit later, but we've really been able to do this. So in a time where you have an infection that kills people, that cripples people, that makes it where we're losing loved ones left and right, the vaccine prevents you from getting that infection and helps prevent you from spreading that infection to your loved ones and to the community, and so that we're all protected.
Wow. That was great. Dr. Huggins, would you like to add anything?
Really? What would I add? That was perfect.
I figured I would open the floor, but I knew exactly what you were going to say. Thank you so much, Doc. That was a great first question and a great response. We're going to keep it going. It's your turn, Diana.
Yeah. So, Dr. Foy, as you were going through the history, of how vaccinations came about, I think Erica and I were both just here sitting in shock. And it's not very many times that we are speechless. We both know the importance of getting vaccinated because we were told, recently, but not necessarily the history. So that was really amazing. Certainly something new that we have learned today. So fast forwarding to present times of COVID, we have heard about all the types of vaccines. So Dr. Huggins, can you tell us the brands of vaccines that are available to us in the US right now?
Okay, so in the US, very, very good distinction there. In the US, there's 3. So we have Pfizer that's available 2-dose. We have Mrna that's available 2-dose. And we have the Johnson & Johnson that's available 1-dose. And to be clear, the Johnson & Johnson is back and available. There was a pause, but as of today, I believe actually the 23rd, Dr. Foy can probably confirm that, but the CDC did recommend that the Johnson & Johnson can go ahead and be given back out there to be given. So the difference in the vaccines, because I know that question comes out a lot, and patients want to know which one's best, which one should I get. To be honest with you, and I definitely want Dr. Foy to chime in on this towards the, as I conclude, whatever you can get your hands on, get it. The differences really are 2 of them are 2-dose, 1 is 1-dose. The Pfizer is a 2-dose one. You should be getting your second dose within 21 days of your first dose. Okay. The Mrna, again, 2 doses. You should be getting your second dose 28 days after your first dose. Now, what if something happens? Because life happens. Car breaks down on the way there. I don't know. They run out of vaccines, God forbid, whatever. You can still get your second dose as long as it's given within a 6-week time frame. However, again, in general, Pfizer, 21 days later, Mrna is 28 days later. The efficiency of those vaccines are both in the 90%. Okay, so to be specific, per CDC, Pfizer's 95, Mrna's 94, 94.1 to be exact. So if you were to be fully vaccinated, that is the percentage of your body, well, not your body, but the percentage of you possibly not getting affected if you're exposed. Possibly not. Nothing's 100%, but there you go. Now with Johnson & Johnson, it's only a 1 dose. So you get it one time deal and you're done. And a lot of people want that. They're like, hey, let me just get it one time and I'm done with it. And that's totally appropriate. The effectiveness of that one per CDC is 66.3%. Okay. We'll take it. We'll take it. It doesn't matter. If you want it, get it. If your hesitancy has anything to do with you don't want to get 2 shots, then get the Johnson & Johnson. Now, as far as age restrictions, you have Mrna and the Johnson & Johnson. You have to be 18 or older. The Pfizer, though, you can be 16 years old. So parents, if you have any kids that are 11th grade, 12th grade-ish, kids that are going off to college, living in dorms, with the fact that I am employed at the University of Florida College of Nursing, I'm aware of when the campuses plan to open back up and go back in full force and full effect. And that's fall of 2021. So again, if you do have kids going into college as freshmen or already there, this is something that you definitely would want to speak to your child about. This is being recorded, maybe let the child look at it as well. And you all come up with an informed decision on if it's the best thing for that child to be vaccinated. And again, if they are not 18 years old, but they're at least 16, Pfizer is your only option. As far as the Johnson & Johnson, just really quick, it's still a really good option that's out there. The buzz about that and why it was halted is because some research had shown that some people were getting clots, specifically CVST, which is called cerebral venous sinus thrombosis. Once they paused it and looked into it and did all the research, they realized that this was only occurring in females. And usually their age ranges were 18 to 50-ish, 18 to, I think, 49 to be exact. The risk, though, was greater in people who actually had a known blood disorder, mainly thrombophilia. Maybe if they were also on oral contraceptives, so birth control pills of some sort. And sometimes obesity was associated as well. Outside of that, it wasn't a big risk, so to speak. And it wasn't a lot of people that it did occur to. So they felt as though it was appropriate to re-release the Johnson & Johnson. And again, the main reason we're having COVID talks in general, just making sure that people were aware why the Johnson & Johnson was paused, what they were looking at, what was found. And so again, you still have your informed decision if you want to do the Johnson & Johnson 1 dose versus the Mrna or the Pfizer. It is not contraindicated for someone who's on birth control to not do the Johnson & Johnson. It is not contraindicated for females to not do the Johnson & Johnson. It is not contraindicated for anyone who has known, that's between the age of 18 and 49. It's not a contraindication, but you do need to be aware and make that decision for yourself.
So yeah, and I'll just add, and so that was awesome, all that information, and so a couple of just quick things, and Dr. Huggins has already stated it when it came to kind of the numbers, because I think hearing the numbers may actually be helpful too. As of yesterday, when they looked at it, you had 8 million people who had been vaccinated and 17 who had the clotting problem. So 8 million, so 17 out of 8 million. They did have their first man who actually ended up getting it, having that cerebral venous sinus thrombosis, but it's just been 1. And so there's still so much to learn and so much to be done in the context of what's going to happen once people are vaccinated. But the thing to know, this is a normal part of the process. That's a natural thing that occurs after every vaccine that is released. We always do continuous surveillance. The difference is that in this moment, the camera is on every vaccine, every person who presents. So we're used to, in the community, the science community, knowing that if a vaccine or a medicine or something is released, there's a potential risk and benefits. And we're always looking at what is the benefit over the potential risk. And so surveillance goes on. We're not just looking at what's happening to people taking the COVID vaccine because we think it's new and different. No, this is how this process normally works. And when people are hearing about it, it scares them. It makes them feel anxious and nervous because they think, oh my goodness, this vaccine is causing these things. And the reality is, again, when you look at the natural population, the likelihood of someone developing a cerebral there's a lot of words to say.
CBSP.
Complications could potentially be equivalent to what you would expect with the population anyway. But we're a year out. In 2 years, in 3 years, we'll know even more. Most often, surveillance time frame is within 2 years of getting the vaccine. So, or the release of the vaccine. So, this is a very common, typical thing. There are some in the science community who feel like the pause was maybe an overreach because this is something that we're used to. We know this. We understand why it was done because we want you to be comfortable. We want you to feel good about whatever it is that you're putting in your body. And we want you to know that we are doing our due diligence to make sure it's safe. And so that's why if a pause is needed, a pause is needed. The same way sometimes I have to take a breath is the same way, just in the big picture, when we do big things, we have to take a breath. But now it's time to get back to business. Now it's time to say, okay, we've looked at it. This is not something that should keep you from getting the vaccine because the benefit absolutely outweighs the risk.
That was really good. And we're actually starting to get questions here in the chat. So people are listening and they're getting well informed and they're asking a couple questions. So this one, and either doctor can take this question, or if you want to tag team it, even better. But this is from the Johnson Healthy Living Center. And this question is, once vaccinated, could you still get COVID-19 and or transmit the disease?
I mean, I can start it and Dr. Foy can definitely finish. Again, with the percentages that I told you with all three, yes, you could still get it. What the research that is out that has shown, well, really, it's been just more or less, they may be asymptomatic though. They may not know that they even have it, or if they do know they have it, they don't have half the degree of the symptoms that anyone else would have. So could you still get it? Yes, it's not 100%. Now, as far as how long does it last? We don't know for sure yet. Research is still being done. But just go ahead and throw it out there because it's already out there. If you're on social media, if you read CDC, if you're in the research, there's been talk that there might need to be boosters done. We don't know. We don't know that answer for sure. We don't know if we would ever need a booster because, like tetanus shots, we get boosters for those. We don't know. We don't know as if we do need to get boosters when that time frame will be yet. We're just not sure about that. And then, okay, I think that was the extent of her question. I was kind of looking there. Dr. Foy, what would you like to add?
Well, and so what I was just going to say is, I think this is maybe a good moment to talk about why people get more than one shot, why more than one shot is needed. And perhaps that'll help us understand this whole concept of boostering. Dr. Huggins already explained, none of these things that we say were 100%. So because nothing is 100%, then you're going to still have the opportunity to get an infection with any vaccine that we give, whether it's your yearly flu shot, whether it's some pneumonia. The idea is that because you have prepared your body in a way, it is actually now has an opportunity to truly fight the infection, to truly fight it as if it has seen it before without you. Because if you had not had exposure to it, then now the virus has the opportunity to get ahead of you inside your body. So when it came to particularly, since we're dealing with COVID, the COVID vaccine, what they saw when they were doing the research, when they were doing the studies to get approval, was that by a month out, the numbers of antibodies that were in a person's body were not at the level that we wanted it to be at to provide the type of protection that we thought would be maintained and last and continued. And that's the way viruses or infections work. When you first get exposed to it, and I'm sorry, that's the way vaccines work. When you're first exposed to it, your body creates an immediate response. And those soldiers go out and they do their best and they fight it. However, the second time you're exposed to it, because now we kind of have a blueprint, we know what to expect. We know what the infection is. We now can make stronger soldiers. Your body can make stronger and even more soldiers because now it knows what to activate. It knows how the recipe to put it together. So because of that, you get a stronger response the second go around. That booster gives you a bigger response. It's not even just adding on to what you have already been given. It is now those soldiers that can last longer, that can really do the job that you need it to do to protect you. So Pfizer specifically said, the CEO of Pfizer said he believes that we'll need a third booster, a third shot. Right now, though, what has been shown is that at least 6 months out, both the Moderna and the Pfizer, people are maintaining at least 90% of their immunity, where they're still at least 90% less likely to obtain a symptomatic COVID infection. And so that really still puts, but it's going to take days passing for us to really know. And that part's already been stated beautifully by Dr. Huggins. So we'll let the days pass. So what becomes important then is focusing in on the now. How do I protect myself now? How do I protect my community now? How do I protect my family now? And the way you can protect them now is to get vaccinated now. And when I was in residency, I'm going to tell a boring story, I'm sorry. But when I was in residency, my first year of residency, the vaccine, the SARS, that's when SARS initially came out. And so as I was training at the Mayo Clinic, and I was training with these wonderful people who were brilliant, but we were standing in front of the televisions, petrified that it was going to come here, petrified that we wouldn't be able to protect ourselves, that we wouldn't be able to protect our families and our communities. So it was in those moments that people started trying to really work on and develop a way to protect this world from COVID and other viruses that would just run rampant. And so I remember feeling like, and hearing, wise physicians saying, I hope it doesn't get here. I hope it doesn't come here. God help us if it does. So as the years have passed, my mindset has been prepared for something like this happening. The medical community has known that at some point, we were going to be faced with the same things that they've been faced with for the last thousands of years. This is not new. We've had smallpox, we've had the plague, we've had all these things that have happened before. So this was bound to happen. So one of the myths and concerns about COVID is, well, where did it come from? Somebody created this in a lab and this is where it come from. And I know we hesitate in talking about those things, but that is what's on people's mind. That's what's keeping them from buying into or really embracing the reality of what they're dealing with, because they're distracted by this idea, well, there's something that someone created. Evolution is what it is. We are wowed and amazed by animals we've never seen before, and creatures we're discovering. Viruses and infections work the same way. They evolve, they become more infectious. And because of that, we have been blessed enough to learn ways to protect ourselves. And that's what vaccinations are about. So we have been able to get rid of something like polio, for instance, in our country. Polio, the people who are watching, if they're older, they know what polio is. But many young people, they don't know what polio is. And you know why? Because it was eradicated. How was it eradicated? vaccinations. We made sure that young people got vaccinated. And now in our country, you don't know what polio is. Unfortunately, in places that can't afford vaccines, that don't have access, they still have polio cases. But because we're in a world where we care about each other and we want to make sure we're protected, we try to make sure even those places that don't have access also get these vaccines. But you're here, you have access, you have opportunity, you have no excuse to not protect yourself and your family and our communities. The question you want to ask yourself is why not? Why not protect yourself now?
All I have to say is wow. I mean, so beautifully and eloquent, you know, and just explaining that and explaining to people the importance of vaccines, you know, the history, you know, both of you so far. It's just, this is incredible for us to listen in. I could imagine everyone else tuning in. So we're gonna not really switch gears, but kind of expand on COVID a little bit. So it was COVID-19, then we started hearing a little bit more about the variants. Dr. Foy, can you tell us a little bit more about the variants and, you know, perhaps, you know, to the viewers, maybe some of the misconceptions or things that they're assuming about the variants? You just expand on that a little more.
So yes, and I'll try to do my best with this. So I kind of mentioned it a little bit earlier, how things evolve. So whenever there are infections and viruses that present themselves to the world, this COVID-19, the reason why it's COVID-19 is because it's not the first COVID. It's not the first coronavirus. Throughout time, you've had different presentations and variations of this COVID virus. So it's kind of like if you have a Mercedes and they sometimes put the lights in the front or the lights at the top or make the doors fly open, it's still a Mercedes, but it's a different form of it. Well, infections and viruses kind of work in the same way, in that after a while, if the virus is being not able to replicate or infect people the way it can, the same way we try to beat it, it tries to find ways to be stronger or different. And so as these cells are turning over and replicating and duplicating itself, sometimes a mistake happens. And I call it a mistake because that's what it is. It makes a copy that doesn't look like the original version of it. So in making that copy, now you have a new version of what the virus was supposed to be in the beginning. So now, instead of a person being overrun or infected with what it originally got exposed to, when the copies are made, they're creating a whole new variant of that virus. And that's why it's a variation of what it kind of started out as. And so now when that person sneezes or coughs on you or talks in your face and releases those respiratory particles, they're passing on something that was not what they may have originally received. And so now this new version or this new variant is being spread from person to person to person. And in the same way that mistake happened in that source, 50 people down the road, 1,000 people, 100,000 people down the road, it is now also change again. Another mistake happens and another variant forms. So that's why we get these variations in this one particular virus. The good thing about it is, though, the DNA is the DNA. And so a lot of times, even though you have this variation or this mistake, the medicines we use, the vaccinations we've created are enough of that same genetic information where it can still fight it, where it can still protect you against it. So when they're developing these vaccines, there's this understanding of the potential for variants and the potential for changes. And because of that, we don't just use one thing. We don't just use one piece of information to make these vaccines. We use different portions and make a soldier that can hit it a lot of different ways so that if those variants occur, you still have some protection. It may not be the 100%, or it may still maintain the same level of immunity, but regardless, you'll get some protection. I'm going to take a moment to, this is something we deal with every year with the flu vaccine. So again,
I was gonna actually chime into that, and it kind of piggybacks into that other question about the booster. Exactly. Continue, Dr. Foy. Why do we have to get vaccinated with the flu every year? Exactly.
Right. And this happens. So a couple years ago, and this is where we go wrong when we give information. We give bits and pieces in 30 seconds. So that's why Dr. Huggins and I don't mind taking an hour, which is still not enough time to really educate you. A couple years ago, those variants in the flu vaccine occurred. And the flu occurred mid-season. The flu switched. Some of what the flu started out as, and that they had made all these vaccines against, were it switched and mutated a little bit, but only one part of it mutated. As media presented it, it said, well, the vaccine's not going to work because the flu changed. It's a different variant. So people stopped getting it, and it was the worst thing they could have done. So we had one of the worst flu seasons where more than 80,000 people died because it was misinformation. What people didn't understand was, no, they still needed to get vaccinated, because it's the difference between what we see with the vaccines we have now. One's 94%, one's 67%, where you're still getting some protection. You're still going to be able to have some protection available. So you still want to, even with the possibility of it not being the level that it started out with, you still have less, you get less sick. You don't get as sick as you would if you didn't have any type of vaccine or any type of immunization, because your body is still prepping. It's still prepared itself for an infection with something. So you want to make sure that even if you hear about these variants, there's still value in you going ahead and getting vaccinated, because you'll still have some protection. So know that you will still have some protection. So don't think, oh, I'm not going to get the vaccine because the stuff that's coming out is different and it's not going to even protect me. No, go get the vaccine because you'll still have some protection.
And just to add on to it, with putting on my professor cap here a little bit, sometimes to break it down a little bit more, which she still gave a very good explanation. It's almost like, because a lot of people, they say that, they're like, oh, that vaccine didn't even work. They don't even know what they're doing. They got it wrong. No, they didn't get it wrong. They got it right. Kind of think of it as an exam. So you are as a pop quiz, for instance, you have a big exam coming up because it's on the syllabus, or the professor has told you. And you've come to class, or you're supposed to be reading and all of this stuff. And all of a sudden now we want to do a pop quiz. We want to kind of just see, what do you know, or have you, looked into anything? And then when you get this pop quiz, you're kind of shocked, you're stunned, you're kind of like, well, where did this come from? I mean, some of the information is recognizable, but not all of it. Does that mean that it was wrong? The information we're giving you is wrong or anything? No, it's just, all of a sudden, the initial vaccines that are out are made based off of the information that we know. The Mercedes classes that we actually see, that we see on the street, that we see where their lights are. So you're gonna always go and make it based off of that. It's just like a recipe. You make a peach cobbler recipe, right? So you get that recipe from one person, but then you might go to someone else's house and they threw something else different in their recipe. Well, that's a curveball. But that doesn't mean that the initial recipe is wrong, or that the initial recipe won't taste the same or react the same. So you kind of have to look at it that way, as it's still a positive. It's not a negative. It's not one peach cobbler tastes better than the other, or one peach cobbler is now called a peach cobbler and this has to be called something totally different. No, they're all same things. They're just variants of it. So just to solidify what Dr. Foy is saying, you never walk away or run away from a vaccine because a variant is out. If anything, that's when you really want to make sure you get it, so we can continue to do what we call, if you all heard the word, herd immunity. You want the majority of that population to be protected against something, so we don't have to recognize that again. So that's what our parents did for us with the smallpox. That's what I've done for my children when it came to polio. You know, I was part of that herd immunity for polio. I'm not part of that herd immunity for smallpox. Why? Because my mom did that. My dad did that for me. So I don't have to worry about that. But as a parent, yes, I'm a parent. I decided to get the COVID vaccine because I wanted to protect my children who are all under 18. And so, as Dr. Foy say, it's very important to be educated, you know, be educated and make your informed decision on what you want to do. But if you do take that step to get vaccinated in either of the vaccines, what you are doing is protecting not only your community and your family, but you also want to consider your children and the community children, people that if they can't protect themselves, we as a community, as adult community, should be able to protect our children. So keep that in mind as well.
Thank you. That was great. And you know, Dr. Huggins, you know I love your peach cobbler analogy, so I appreciate that. Thank you for breaking that down for us, ladies. I wanted to go back to the vaccine question that was out there. And if you could, Dr. Huggins, just talk about, and I know you spoke about this earlier in the beginning of the presentation, but just some common side effects experience once you receive the vaccine.
Once you receive the vaccine, again, this is individual to people, Fever is a very common one. Well, let's separate it from the actual shot itself. All shots are given in the upper arm, a muscle in your upper arm called the deltoid, but it's in the upper arm. So all shots are given there. Commonly, you may have tenderness, soreness, or pain at that actual injection site. Maybe redness, of course, it will depend on complexions and all of those things at the actual site. Now, things that may occur, and that can occur within hours of the injection to a day or later. The other side effects that may occur within a day or two, and they usually resolve within 3 days, they are usually gone. We would say give it a week, but usually within 3 days, would be your fever. You're tired. You may have some nausea. You can have some nausea. Something that a lot of people aren't aware of, and I want to make sure that they do know, is medically it's called lymphadenopathy. So we all have these lymph nodes throughout our body, all throughout our body, everywhere. And depending on infections or just something new, like Dr. Foy said, the vaccines is exposing something to us so we can build an army to fight against it. So when you get these vaccines, your body's not used to it initially. You get all these side effects. Well, sometimes those lymph nodes, because they're trying to fight off and work, they get swollen, they get bigger, and they get sore. So you may notice if you move your head or you move your arm, or why is my neck sore, or somewhere in this area is a little sore, your lymph nodes are swollen, but that's a good thing. That's the catch. You have to look at it. That's a very good thing. That means your body has reacted to this vaccine that has come in. It didn't recognize it, so it's building that army to kind of fight against it. It goes away though. It definitely goes away within a good 14 days for sure. It's going to go away. And I can speak from personal experience with that. Within my first vaccination, I actually got the lymphadenopathy. Now, to make sure that you want to say it's definitely linked to the vaccine, you should only have that swelling on the side that you get your injection. So I choose to get all my vaccines on my left arm because I'm right-handed. So on my left arm, I got vaccinated. Then I ended up getting that lymphadenopathy on the left side only. It did not show up on the right, and that is appropriate. But I want to make sure that key point is out there, because what has been happening is some people would get mammograms, specifically women, would get their mammograms done within the time frame of the vaccine, and then on the mammogram, these lymph nodes were showing up. And a mammogram, of course, is looking at breast tissue, and breast tissue is around the upper arm. So the lymph nodes are all in that area, and swollen lymph nodes or inflamed lymph nodes on a mammogram is not a very good look. So of course it was a little more concerning. So make sure, specifically women who are getting their mammograms over 40, that's just a little preventative plug here, 40 and greater. Some people might have to get it less. Make sure you are aware of that. I would recommend that you kind of push your mammogram off a little bit from the vaccines, just so you don't even have to deal with that specifically. But make sure you're very much aware of that as well. But those are usually the more common side effects, and headache. Excuse me, that's another very common one, headache. So a lot of people will get the vaccine the first time and they may spike a little bit of a fever. They'll say they had a headache and they slept a lot the first day after. They were very tired and slept a lot. Usually within the 48, 72 hours, they're back at it. They're back to being themselves, their normal selves, doing whatever it is that they need to do. So other things I do recommend, it's definitely not a requirement. And it really, again, it is individualized to what you do on a daily basis, if you're working from home or not or whatnot. But if you have to kind of be out and doing and going, I do usually ask people or suggest that they do get vaccinated, maybe on a Thursday or Friday, so they have the weekend to get those little headaches and fevers and just being tired out of the way. But hey, if the vaccine isn't available on a Thursday or Friday, then get it on a Monday or a Tuesday or a Wednesday or a Saturday or a Sunday. We really don't care. But those are things that you do want to consider and know that are very common. They are expected, and it's not doing anything crazy or different. Think about it. You take medications, you take prescriptions, all of them have side effects. Vaccines are going to do the same thing. So it's not anything abnormal. It's not anything bad. And just to kind of co-sign before Dr. Foy chimes in, if you do and when you do get vaccinated, they should give you an information sheet based off of whatever vaccine you choose. And there is a registry called Be Safe that you really, really should register for. And it's a really, really cool, interactive, easy to navigate, very quick, right? App. If you just log in, download it, put your information in, all they want to know is your name, your date of birth, and which vaccine you got and what day you got it. And it will send you text messages within certain days based off of when you got it. Then it'll push back into weeks because they want to see what are your specific side effects. And it'll ask you questions like, were you ever exposed to anyone with COVID? Are you pregnant? Are you breastfeeding? Has anything changed? And this is a very, very good way for you to also add on to your contribution if you do choose to get vaccinated. Now you can continue to add on to your contribution as far as research is concerned, because those Be Safe registries are used to be able to look at certain things to know, okay, this is what's happening. Lymphadenopathy is normal. Oh, this is happening more commonly in pregnant women versus not. This is happening more commonly in maybe this race or this sex. So make sure once you do choose, hopefully you will choose to get vaccinated, still your choice, but that you do look into signing up for that Be Safe registry. Anything else to add to that, Dr. Foy?
The only thing that I would add, and of course that was wonderfully said, I want to bring home the point when we talk about what you feel after a vaccine, because when it comes to what's happening with your body, sometimes people think they have the infection. That means that they have a little bit of COVID or they have a little bit of the flu or whatever it is they're getting. And the thing that I want you to know is that with these vaccines in particular, you're not getting, well, with the Mrna and the Pfizer, you're not getting any of the virus material at all. And then with the other, you are getting a disabled virus that actually isn't the coronavirus. And so you're actually not getting the infection being introduced in your body. So you're not getting a little bit sick from the infection. What is happening is your body is actually doing what it's supposed to do. And so it's not even quite a side effect per se. It's just you're feeling your body working. You're feeling your immune system working and revving up and creating antibodies the way it's supposed to. Some people feel that, some people don't. So for me, when I got vaccinated, and actually, and so I got it pretty early on, and just like Dr. Huggins, I actually got the swelling under the arm, but they didn't know about it yet. And so And I didn't get it right away. My arm was sore. I had a fabulous person who did my shot. So I kind of forgot I even had the shot that day. And then 6 hours later, my arm was hurting. I was like, oh, why my arm hurt? Oh, because I got a shot. And so that actually lasted in me. And so it's important for you to know we got vaccinated. We're not telling you to do something that we wouldn't do. So my arm hurt. And then literally 2 weeks later, I started having those swollen glands. Now, mind you, I got my mammogram done 2 days before I got vaccinated. I was in a preventative mode. So trying to protect myself from everything. So I had gotten my mammogram, so I didn't get worried. And then I was like, well, this is the arm that I got vaccinated on. Let me see if there's some reports. And so I went and looked, and there was just the beginning of, hey, there may be some axillary swelling or enlarged glands or swollen glands on the side that you got vaccinated on. So what we're recommending now is to wait at least 6 weeks. So you don't have to delay your mammogram long. I don't want people to kind of do that and then forget when they're supposed to do it. So about 6 weeks is that time frame that we would say to push it back a little bit if you're going to be vaccinated. But these symptoms you have are your immune response. Just like if you didn't get vaccinated, when you are sick with something, your body is trying to fight it. So some of what you feel is your body fighting it and your body trying to keep you well and trying to keep the infection from taking over, as opposed to it being just what the infection is causing you. You have chills because your body is trying to bring your temperature down and to keep you vacillate between fevers and chills because it's trying to keep your temperature within that normal range. There's things that are happening because that's what's supposed to happen when your immune system is doing the job that it's supposed to do. So don't be afraid of those potential symptoms, but also know you may not get them. Like it may be completely fruitful. You'll be going in there praying, holding your hand, you go in there, you get your shot, you barely feel the shot, and then you feel just fine. You go about your business. And then when people are talking to you about what they felt, you're like, well, I ain't feel nothing. I don't know, is that wrong with me?
Right.
I suppose
But then that's very important.
I had people who's like, I don't know that I really got it because I didn't feel
everything everyone's saying. Exactly. That is why it was an easy response for me to say, yes, I would love to speak about this, because we tend to do that. We tend to listen to what I call the street news. We tend to listen to everyone else and what happened to them and their experience. And that heavily weighs on our decision. But we don't know if they're, first of all, we're not genetically the same, none of us. So that's number one. Number two, we don't walk around with our health history on our back. Mm-hmm. So we don't know, did this person have, I don't know, do they have diabetes or hypertension? Do they have that thrombophilia or thrombosis or any type of blood disorders? It's a lot of things we don't do. Do they have asthma? Do they have respiratory issues already? Did they already have a fever before they had the vaccine? It's a lot of things you just don't know, but they only tell you what they want you to know. And then you take that and you're like, oh, I'm not getting vaccine because I don't want to get sick and I don't want to do this and I don't want to do that. The only thing I actually had was that swollen lymph node, which did not stop me from anything. It didn't stop me from working. It didn't stop me from being a mom. It didn't stop me from doing any cooking, not anything. And I slept the day after. I will admit, I slept. But out of that, I didn't have fever with either one of my injections. And I didn't have headaches that I think were associated with either one of mine at all. But those two are very common, fever and headache. And I didn't get it. I was anticipating and I was waiting and just in case, but I didn't get it. Another thing, just really quick sidebar is, and I probably should have spoke about this when I introduced the different vaccines, but like Dr. Foy said, it's the Mrna and the Pfizer. None of them are giving you COVID. None of them are giving you COVID, okay? Mrna and Pfizer are actually giving you mRNAs, so messenger RNAs. So basically, it's almost like Dr. Foy has said this before, a blueprint, okay? I'm not the virus, but I kind of know I'm an impersonator. Let's say it like that. So I'm not it, but I know how it looks a little. I know how it moves. I know what it's going for. I know what it's trying to cause. So we're introducing that when you're using the Moderna and the Pfizer. And so, like Dr. Foy said, you're not getting the vaccine, you're getting an imposter. But that imposter is doing enough for your body to say, just think about your apartment, your home or whatnot, right? And you don't have an alarm system, you don't have a dog. And this person knows that, the COVID knows that. They know your guard is down, you don't have any protection. And so it can come in and it can wreak havoc. When you get a vaccine, what's happening is now all of a sudden, say you had an alarm before, but you never turned it on. I don't need to turn it on, my neighborhood's safe. Well, now your body's turning on the alarm. And now your dog is kind of like, oh no, I know everybody that comes in this house. I know friends, I know family. This isn't a friend, this isn't a family. So before it can get in all the way, or once it's in, before it can start moving stuff, or maybe it can get in and move the stuff, but before it can get it out of the door, your soldiers, your posse is there like, you're not part of this family. You're not part of this house. You're not part of anything. What are you doing? And so they can attack it. And that's what happens. That's what the vaccines are. But we're not giving you the actual virus. It's a messenger RNA. As far as Johnson & Johnson, it's not a messenger RNA. It's actually giving a viral vector. So again, it's still not COVID. However, it's giving you something that is very similar, that in its shape, okay, looks similar. And both of them, the biggest thing is this, what they call this spike protein. That's like out of the COVID virus, the virus itself has all these different proteins, okay? I don't even remember, is it like 80 something plus back? We're not even gonna go there. That's like epidemiology. I don't know. But it's just this one vaccine. It's almost like the monarch of the family, right? Or the queen bee of a hive. Like, that's the biggest protein, spike protein. So that's what a lot of vaccines are created around, that and the appearance of it. And so make sure you understand that, please, 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 you are not getting COVID. None of the vaccines are giving you COVID. They're just giving you impersonators to make your body get prepared and build that a soldier by soldier by soldier. So eventually, if you're ever exposed, now you have an army that is ready to protect and defend your body, or my analogy, your home. And so that's how you need to look at it. So I will also just throw out, because of what I said, if you were to get tested for COVID, would you test positive? Probably will not. And the reason I throw out probably is because we are using most of the testing that we like, and that will clear you to travel and clear you to go back to work and clear you to go back to school, is called a PCR test. You're not going to come out positive on a PCR if you're vaccinated with any of them. Now, if you were to get a blood antibody test, the antibody is going to come out positive, but it's not necessarily saying you have COVID. It's probably saying you've been exposed to COVID. So if you truly got COVID on your own, no vaccines, you have antibodies, or you would have antibodies, depending on the time frame of when you got the antibody test. And if you did get the vaccine, you may show antibodies against it, but you should. That means that the vaccine worked. And there are different antibody tests. So let me make that clear too. There are some where we can see, do you have an active disease right now versus have you just been exposed in your life? And so this may not hit home with everyone, but it may. If everyone usually should have gotten the measles, mumps, and rubella vaccine, it's an MMR. If you were to go, you can get an antibody test and it will tell you if you have antibodies to it, but that doesn't necessarily mean you had it ever. So I've gotten an MMR because I had to as a child. That's one of those vaccines that Dr. Foy talked about. We are all protected against, so you don't really see it around. I've never gotten the MMR myself. I've never gotten, measles, mumps, or rubella, but I've gotten the vaccine. So when they draw my blood for an antibody screen, I come up positive. That doesn't mean I have it. That just means I'm protected against it. And so those are the differences that you have to make sure that you know, and make sure you truly understand that what an antibody is, how do you get it, and is it a good thing to have it or not?
And
But
Dr. Huggins, I'm sorry, because there's a couple questions that are in the chat that are kind of related to some of the things that you're saying.
Yeah.
And then I also want to just make one comment. So there's a question about once you get vaccinated, and well, someone who actually was infected, they wanted to know if they tested positive in June of last year, and their body is still showing antibodies. Do they still need to get the vaccine? And the answer would be yes, we would recommend it. We usually recommend that you get vaccinated at least that you wait 90 days. And part of the 90-day wait had more to do with our concerns about not having enough vaccine available for the population. That was one portion of it. The other part of it is we want your body to be in a position to make soldiers, to really make the soldiers, the fresh, good soldiers that we need. So the variant that you might have gotten and were exposed to when you actually had COVID, the antibodies that you make there may be a little bit more specific for that infection and not give you a more global kind of coverage. And so that's why when the vaccines are created, it's presented in a little bit of a different way. So the genetic information may create a different level of antibodies. So you still want to go ahead and be tested. I mean, want to go ahead and get vaccinated. So that is important to do. So again, we recommend if you had COVID, that you within 90 days is a good time frame to wait until you go ahead and get get your vaccine, but you should be vaccinated. Another question was, should you, if you have symptoms of the coronavirus after you have been vaccinated, should you be tested for the infection? The answer is yes, because again, it's not 100%. And so since it's not 100%, you could still potentially have an infection and you should still go get tested. Now, the likelihood is you won't feel as sick, you won't feel as bad as you would, or as bad as you might have had it did when you first were exposed to it. So that's the benefit of the vaccine, is that it helps to decrease those symptoms, our symptomatic infection. And so that's answered a couple of questions. I do want to say one other thing before we go back to a lot of great questions in the chat, because this pertains to one of the things that feeds into the hesitancy of getting vaccinated. I get a lot of questions about the mRNA, and Dr. Huggins did a great job kind of explaining what the mRNA virus vaccines are. And so one, they're not the infection. And we've been working on mRNA vaccines way before COVID happened. So that's the important thing to know. So one part is a part of our hesitancy to have a vaccine is this feeling that this happened too fast, that they rushed it, that they skipped steps. And to help clarify that, no steps were skipped. We, instead of it being like a dot to dot, you go from this step to this step to this step, they did multiple steps at the same time so that we could get the information that we need to feel safe about the vaccine. So that's the first thing to know. The other thing is, because it's an mRNA vaccine and this new technology where you don't have to actually expose people to infections, you can make those very quickly. And so that's a part of the other reason, whereas with the traditional vaccines, you have to incubate them and do all these other things that allow them to grow, and then you have your protection. Well, with these, you just make the mRNA protein, you use the mRNA protein, you duplicate it, and you can inject it. And so that's why that process was able to go a lot faster. And we've been working on that for years, had done it with things like with Zika, which you guys probably have heard of in the news, other things. The one other myth that I get in association with people hearing mRNA, they know DNA, mRNA. So they wonder, wait, does that mean this is going to get in my body and change my DNA and make me something and make me grow a third arm and all these things? And the answer is no.
Not at all. You won't have an eye right here, a third arm, an extra leg.
And the reason why you won't, because this is the part.
One more, and you won't be dancing like one of the Michael Jackson Thriller dancers. Right. Go ahead.
And the reason why you won't is because we talked about how this, when we give you this vaccine, and it's an mRNA vaccine inside your muscle in your arm. Well, when that vaccine is given, it creates that spike protein. And that spike protein is created and it pretends that it's a piece of COVID-19. Well, as soon as your own body recognizes it and say, hey, you're not supposed to be here, and it starts making soldiers against it, that spike protein actually self-destructs. So it has a built-in mechanism where it's not staying inside your body. It does not become a part of your DNA. It does not even stay inside the muscle cells. It never penetrates the nucleus of the muscle cells. So it's not becoming a part of your body. And that's one of the things that has frightened people, because they're getting misinformation about, hey, this is going to change your DNA. Another part of that was the idea that it looked like a protein that women get when they are trying to have a baby and fertile. And so there again, that's related to how the placenta attaches to the uterus. Mm-hmm. And that was misinformation again. No, it is a completely different protein. They have nothing to do with each other. So this vaccine does not affect your fertility, because it is, again, as soon as that mRNA piece is entered, once your immune response starts, it self-destructs. And it's not waiting for, it's not being just destroyed by the soldiers. It self-destructs on its own.
So let me go back to some of the questions. So, because it went.
Dr. Huggins, I'm sorry. So just because I was going to move into, and because I'm not sure you know about this, there was one of the beginning questions was, we've done all this technology with vaccinations for adults. And so the question is, what kind of research is being done for vaccines for children? So actually right here in Jacksonville, there's a study that's being conducted, and we can give you the information to post later. But at the University of Florida, with their infectious disease department and their pediatric infectious disease specialists, they're actually doing vaccine trials for children now. And so you have an opportunity to actually participate in that. It actually is a paid study. And so, and most studies are, so it's to encourage you to participate. So it's not a bad thing. But it is something that is ongoing even locally. Yes, nationally, this is something that is ongoing. Pfizer is doing their studies in children younger than 16. Mrna is also doing some studies, and there are some other vaccines that haven't actually been released yet that are actually also doing vaccination studies in children. There are 20 colleges right now that are making COVID vaccination mandatory. So you want to clarify with your children's schools not only exactly what their expectations are going to be of your children. So I think that helped move us into that question. So I think
so there's some more I just wanted to clarify. Someone wanted to know about breastfeeding with the vaccine. And so what she's saying, number one, make it very clear that these are not in any way altering your DNA. So not your current DNA and not the DNA of possible children that you may birth. It does not affect infertility. And in actuality, there are some research studies that have been done that the vaccine is not only safe in breastfeeding, but it is also safe in pregnancy, actually. They don't see it causing any issues at all. And they actually do recommend, as far as a time frame of when within your pregnancy to get it, it's not 100% sure that we would say, oh, you should get it within this time frame. But to be effective, they do think at least 3 weeks before you deliver. And usually the earlier, the better. But there is no contraindication as far as you getting it while you're pregnant, which also means even if you're planning to get pregnant in the near future, That would be preconception. You can get it in the preconception timeframe. And yes, if you do choose to breastfeed, definitely you can take it then as well. So no issues there. Someone else wanted to know if they tested positive. And I think, Dr. Foy, you did mention this a little bit, but as I kept reading the question, she wanted to know, she tested positive in June. Does she still have antibodies to this day? We're not 100% sure. However, if you contracted COVID vaccine on your own, getting the vaccine is still recommended. Dr. Foy made it very clear that, usually it was a 90-day window that they were suggesting if you actually contracted COVID yourself versus when you would get the actual vaccine. So we would still, again, recommend you get the vaccine. And then I think there was a question and someone helped me. They wanted to know, if they had COVID and they tested positive, like, do they need to retest again at a later time? Or I think the question kind of wanted to know how long would they test positive. Dr. Foy, you co-sign on this, but from what I've been seeing, it's not uncommon for you to have COVID. Of course, you need to self-quarantine for the 10 days. You can test positive a month later and you can test positive 2 months later. You might not, but you could. The recommendation I know because I'm an employee of the University of Florida, what they're telling students is if they've had a positive COVID, they got COVID, not the vaccine, they actually got it, that they don't necessarily recommend them retest any sooner than 90 days, because you may still test positive, but you're not, as long as you're not symptomatic. That's going to be the big key though, okay? You can't be symptomatic. You can't have fever, chills, headache, cough, nausea, nothing. You have no symptoms at all and you've gotten COVID before, there's no need to retest. There's no need to retest really at all. Not before you get vaccinated. There's no need. You only want to test if you are symptomatic and or if you know you've been exposed to a positive person. Those are usually the times you want to get retested. But other than that, there's no need. You don't get tested after you've tested positive. You don't get retested after.
Well, and we know that some of your employers may have different, so you really want to look at kind of the policies for employers and different places, because some of those, I do have patients where it's still in place that they want them to have a negative test before they come back. And the reason for us suggesting that you don't necessarily need to retest is because the virus may show positive for a while, but you're not usually considered to be infective to another person after about 10 days. Now, a caveat to that is I have had a patient who their body just didn't make good antibodies. And so their viral load actually stayed pretty high for a long time. And so, and because we don't know who those people are going to be, following your symptoms are important. And I know that we have reached time. I did want to answer one question that was really important. And I think this will help kind of bring us home with some of the new guidelines that the CDC has recommended about.
Reading our mind, Dr. Foy. You are reading our mind. That's exactly what we wanted to ask you.
And so, because there's a question that's asking about how do we feel about group events, church conferences, meeting parties, outside gatherings, attend or don't attend. So if you are fully vaccinated, you can go with people who are fully vaccinated, and you don't have to wear a mask if you're with people who are fully vaccinated. And so
you're outside.
Right. You want to encourage your colleagues, your friends, your family to get vaccinated, because in that context, when it comes to gatherings, we're talking about indoor gatherings right now, about church and those types of things, it becomes still very important that you do your due diligence with masking. As you can see, our two lovely hosts, the reason they're sitting next to each other, but right now we still want to make sure you're fully vaccinated. Oh, and we did not say that. Fully vaccinated is once you have completed your series 2 weeks afterwards. The reason why is because it takes at least 2 weeks for your body to build up antibodies to really be at the level we feel like you're protected. And that's why when you first get the COVID vaccine, you can still get COVID 2 days later and be sick and actually have an actual full-blown infection because you don't have the soldiers yet. You don't have the protection yet. So you want to make sure that you're still doing your due diligence indoors. What happened yesterday or day before was that the CDC said for those who are fully vaccinated, those people who are beyond the 2 weeks, of having their vaccine, then they can feel comfortable being outdoors and outside without wearing a mask if they're in smaller crowds and if they're in an open area. Indoor areas, you still need masking. If you're doing a little party at home though, and everybody's vaccinated, then the recommendations are you don't necessarily have to wear your mask if everybody is fully vaccinated in small gatherings still.
And still
Thank you.
continue to do, again, still continue to do your hand washing. I mean, that's still important for all types of viruses, not just COVID. And someone did ask, I think this is another question. I know some people gotten COVID themselves and they're like, I've gotten it, I have my own natural immunity, I don't need to get the vaccine. Dr. Foy and I have already discussed that it is still strongly encouraged and recommended that you still get a vaccine. So the question is, would they be more symptomatic to the vaccine if they've already gotten COVID? And actually, usually not, because their body has already built some form of antibodies. Now, again, like Dr. Foy has already reached on, we're not sure of the level of that, and we don't know exactly what variants either. However, because their body has been exposed, if you go back to my house analogy, their body has an alarm system that's on, period. The alarm system is automatically on a person who's already had COVID versus someone who's never had COVID and doesn't have the vaccine. Our house is unprotected. We don't have an alarm system at all, let alone it being turned on. So that's kind of the way you can look at it. So it'll already give you some type of protection. And so usually your symptoms won't be more severe than someone who has never been exposed to COVID and then they decide to get their vaccine. So please don't let that be a reason why you choose not to get it, because I don't want to get extra sick. You're not getting sick. Your body is working. I don't like that word sick, but you know, if you kind of want to look at it that way, guess what? Think of it this way: the sicker you get, the stronger your army.
Love that.
That's a good one.
If you guys really want to have clarity on who you're able to interact with, how you're able to interact, it keeps on top of cdc.gov. It tells you what the recommendations and guidelines are for interacting with others, for what vaccines are safe, what you should do, how you should protect yourself. You really utilize your resources that are available to help you stay protected. And then if you have not been vaccinated yet, ask yourself, why not? And because that's what I'm going to ask you, and not in the context of challenge, but to really help you understand for yourself. Ask yourself, why haven't you really gotten it? And be honest with yourself. And if you don't have a real good reason, then you should go get vaccinated.
Thank you. That was the perfect send off for everyone. And I know we are right on time. And Dr. Foy, I think you start that clinic at 2, right? So we just, want to, just express our gratitude to you, Dr. Foy and Dr. Huggins, for taking a time to be with us today and educating the community. This was truly phenomenal. I mean, Erica and I are here, we're like, oh my gosh, everything, we had our own misconceptions and assumptions. And so thank you both for, reviewing everything and giving us the facts, not, and I hope that the viewers were listening intently.
It's pretty clear they were.
We had lots of great questions. So just want to say, thank you so much. And for the viewers tuning in, Baptist does have a COVID community nurse line, so you can feel free to call that line if you have questions, 904-302-5050. I think Jean's gonna put it in there. This session is being recorded, so if anybody misses it, we will be replaying this several times throughout our centers. So again, thank you.
Can I just put a plug in?
Absolutely.
I can my turn too.
Some places I know, and Dr. Foy, other places that you might know that I don't mention, Gateway Community. The Gateway
Good point.
is giving out vaccines. I believe EWC, the college, Edward Waters College, they are still giving out vaccines. If you are unsure of where to get a vaccine, again, call that hotline. The number has been posted. Call your friendly doctor. If you don't have one, Dr. Foy is a wonderfully well-renowned and well-recognized primary care doctor with Baptist. So, talk to your primary care doctors, and you know what, even call pharmacies. Some of the pharmacies are actually carrying the vaccines now. So don't let it be I don't know where I can get one from. Oh, they are there and they are available and they are free. So please, if you're really, interested in getting one and your hesitancy is, I don't know where to go. Well, we've given you some areas to start.
Yeah, no, that's great. Thank you, Dr. Huggins. And this, as we close out, I want to thank you personally, Dr. Huggins, for just bringing this conversation to me and the idea and thoughts that you had. And we just thought it was, just a natural fit to reach out to Dr. Foy and have you two smart, beautiful sisters do this for us today. And we are truly thankful. I know the audience members and of our community are also thankful, and we just appreciate your time, and we look forward to an opportunity like this again. And maybe it's not about COVID, maybe it's about some other things that we can keep going, but we'll finish everything up for today, and we'll let you ladies get back to your busy schedules of saving lives. And we are truly blessed and thankful for you.
Thank you.
Thank you. Have a great day.